90% of Americans are deficient, and I'm really surprised with this one. That's huge.
You want to live with vitality, you want to feel your best, but let's face it, we also want to look our best.
It decreases fine lines and wrinkles. It helps the skin retain its moisture. It helps your skin barrier. It helps those cells stay healthy.
I know you feel young, but you want to look young too, and I do too. But there's so many recommendations out there. Everyone's talking about different things on social media. It can be very overwhelming, confusing.
Once they start adding it in, they're like, my nails are so hard. My hair's growing like crazy.
You probably, like me, were looking at people like Demi Moore. How is she not aging? So many of these celebrities recently have been in the news. People trying to figure out, what are they doing? They're aging backwards. Lindsay Lohan, Kate Beckinsale, Nicole Kidman, Jennifer Aniston, J-Lo, Christy Brinkley. They look amazing, and I love it. Now, of course, there's plastic surgery, but it's not the plastic surgery that's making their skin glow, that's making them look so radiant. And why do they just appear more youthful than the general population? It can't all be surgery. Some of these women claim that they've never been under the knife, but yet they look so youthful. Well, the answer is
the women that have that glow in their skin, they're predominantly using Retin-A or tretinoin, a retinoic acid. It's a derivative of vitamin A. It prevents photo damage of the skin. The oxidative damage of the sun to the skin helps the skin heal and be healthy. It helps decrease all the discoloration like melasma or acne scars.
what things really work, what things are a gimmick, what things are a trend, and what things are going to make a difference when it comes to what we put on our skin and what it is we're putting in our bodies. Today, I am inviting the person who I consider my go-to expert, and she is here to share with you the research, the science when it comes to living with vitality, evaluating all the things that are available to us so that you can make an informed decision, spend your money wisely, and do the things that will really move the needle. I am sharing her secrets with you, and we're going to talk about all the things that you need to do, the most important things for you to do when it comes to not just feeling your best, but also looking your best. It is Dr. Kirsten Singler. She is the clinical director at Lee Regenerative. She's a naturopathic doctor. She treats celebrities. She treats people who are on YouTube, and she's here today to share with us the things that are going to help you look and feel your best. We're going to reveal all the secrets, because you really do have your finger on the pulse. You do understand that many of us, of course, we want to feel great and have a lot of energy and look our best too. But when it comes to everything that we can do, it can sometimes be very overwhelming, right? There's so many different supplements that we're hearing about. And what I really want to start with is the most important things when it comes to a woman's appearance. Let's just face it. Let's start with the skin. We're all seeing our face more than anything else. What makes a bigger difference? What we're putting on our skin? You're the person who introduced me to castor oil, but is it what we're putting on our skin, or is it what we're putting in our bodies?
Question is inside, outside. What matters more? Do you want to put gas in your car, or do you want to put tires on your car to take a road trip? You need both, right? For life's long road trip. And I feel like I have this unique perspective because I have this privileged position to treat women that are predominantly perimenopause, menopause age group. And most of my patients live anywhere from Beverly Hills through Orange County. They have access to all the latest, greatest everything. And I have patients that are going to do the latest, greatest, all the cosmetic procedures, all of the surgeries, all of the Medi-Spa procedures,
Yeah.
the Botox, the injectables, all of it. And then I have patients that choose not, patients that are wanting to age gracefully, but they're not doing things like Botox or Medi-Spa procedures. So I really feel like I have this inside scoop, and I get to see these beautiful women as they go through their aging process. And when I think about skin, what do we want from skin? Despite your personal aesthetic, because that's going to be different from person to person. Some people are going to want more of a Botox look. Some people do not want the Botox look. So we got to put that aside, right? So what makes skin healthy and vital? So the moisture in the skin. the dermal thickness, right? Because when our skin thins, that's what causes crepiness. When your skin is thin, that's when you can see like the vessels under your eyes. And instead of it being taut, it looks discolored. It's like right now I have thinning skin under my eyes and you can kind of see the purple hue under there. Whereas when I was 15, you didn't see that.
Mm-hmm.
So that's the dermal thickness. And then the collagen matrix of your skin is what provides it to hold the moisture and keep it in place, right? So we want all of those things to have that like good, plump, thick skin. And then we also want clarity skin.
Mm.
So if skin, say somebody has zero wrinkles whatsoever, but they have discoloration, they have brown spots, melasma, they have acne scars, they have acne, then that's going to be more outstanding and it's going to prevent that glow.
So when I'm thinking about what I'm putting on top of my skin, like, so for example, estrogen cream, what are your thoughts on estrogen cream for the face?
Okay, so there's 3 kinds of estrogen. There's estradiol, there's estrone, and then there's estriol. Okay, so those are Latin for estrogen 1, estrogen 2, estrogen 3, right? There's different forms. There are women and there are studies for estrogen number 2, that's estradiol, that increase dermal thickness and collagen matrix and decrease fine lines and wrinkles. But the thing with estradiol is that it could potentially get systemic. So I would not recommend right now to the audience. I would say you got to work with a doctor. You got to track your lab levels. You might get estrogen dominant and get a period or something you don't want, or get acne because too much estrogen, too much sebum production of the skin. But something like estriol, so that's estrogen number 3, is fairly safe. It's thought that it is unlikely to convert over to estrone or estradiol, the more active forms of estrogen. It still improves dermal thickness. It still improves collagen, still decreases fine lines and wrinkles. I use an estriol. I used to have a pretty crepey neck. I don't have pictures, and I wish I would have saved some pictures because I was covering it up. I wore a turtleneck all the time. But I've used estriol with hyaluronic acid on my neck, and I feel like it's a little crepey, but it's not bad. It definitely reversed. The product that I love is by Quicksilver. Quicksilver brand has one that combines HLA and then estriol in it.
Does that have to be prescribed?
It's over the counter. It's wonderful. And I have other patients that use it and they love it. They'll use it like on the back of their knees, their inner arms, anywhere that there's a little creepy thinning skin. And yeah, it has been improving too for my under the eyes. My patients love that product.
What about castor oil on the face?
Castor oil, it improves that dermal thickness. It's wonderful and it's very moisturizing. It's thick, as you know. The obstacle for most patients is it just getting on things, but that can be managed. Castor oil is phenomenal. People have used it for centuries.
Any other topical treatments that you are like, this is cutting edge, this is what I'm giving my patients who are really interested in minimizing the fine lines and restoring either collagen or moisture to the skin?
Definitely. There's a favorite, of course, Retin-A. Everybody knows about Retin-A, right? Maybe not. I mean, I was raised by a tomboy, so I didn't learn about any of this stuff until much later in life. The women that have that glow in their skin, they're predominantly using Retin-A or a retinoic acid. It's a derivative of vitamin A. It prevents photo damage of the skin. So that's like the oxidative damage of the sun to the skin. It helps the skin heal and be healthy. It helps decrease all the discoloration like melasma or acne scars. I've had patients that use Retin-A that had like a ton of acne scars for when they were a teenager, and then they're on Retin-A for like 10 years, 20. Retin-A is like in it for the long game. It increases good cellular turnover of the skin. So you have those new baby cells that are being born. A keynote for Retin-A is that if you've never used it before, it's going to cause sloughing. So have you ever used Retin-A? Do you use it?
I don't on the regular. So right now I'm like, wait a second, how come I'm not on Retin-A? Does it have to be prescribed?
It is. It's prescription.
Okay.
There's some over-the-counters that are lighter in dose, but like prescriptive
Oh, no, I
grade.
want the heavy stuff. Give me the big guns.
I mean, Retin-A is great, honestly. Decreases fine lines and wrinkles, clarity of the skin, and then it's very oxidative. It's antioxidant to your skin and helps with collagen. And if you were going to start it, if you started a prescription grade, generally you start very low. You start with using it like a pea-sized amount, or like some patients, I tell them like a quinoa-sized amount, like a
Wow.
tiny little drop.
Really?
It feels like you're not even using anything. Like you wash your face at night. When your face is still damp, you put on just a little bit and smear it around. And then you'll see, if you're new to it, it causes your skin to slough, so you're peeling back those layers of the old skin is coming off. And eventually your skin adapts to it over time, and you don't need to use it once a week. You could use it like 3 times a week. And then going from there, you build up to using it nightly. Once you're on nightly, then you can step up the dose, and then sparingly titrate up I feel like over years for most patients.
Is this something we would need to put on twice a day, morning, night?
It's generally used at night because it makes you more sensitive to the sun.
Okay.
And you could burn. You have to really be protective and use like a sunscreen, hats, be careful, not get a lot of sun damage. It makes your skin a little bit more sensitive, and some people don't tolerate it. Some people, it's going to dry them out too much. They have to be careful with it.
In terms of the order in which I'm going to do things, if I'm going to use Retin-A
Mm-hmm.
and Estriol cream,
Mm-hmm.
and I'm also going to be using maybe a small amount of castor oil, is there an order in which you should put these things on?
Yeah, and depending on how complicated you want to make it, but maybe a decent rotation, like a basic and very decent rotation would be Retin-A at night, and then your estriol hyaluronic acid during the day. Like as you're getting ready, wash your face, put on the estriol, maybe use a sunscreen with niacinamide in it, because that's also going to help with that whole radiance, helps nurture the skin so that it can tolerate the oxidative damage. And the niacinamide also good for skin clarity, acne, fine lines and wrinkles. It's good for that. And castor oil, maybe use castor oil like once a week. It's very potent.
This is so interesting to me. If I were to come to you and I'm saying, listen, I want my skin in tip-top condition. I'm going to a high school reunion or my daughter's wedding, and I want to look my absolute best. What supplements would you recommend someone who's like, this is my number one goal, is to improve my youthful appearance?
Well, you don't want to skip the basics.
Okay.
So basic number one is hydration. If your skin is dehydrated, it's not going to have good moisture content, and it's going to look gaunt and thin, and it's going to be dry. So you can't skip. We're all supposed to drink half our body weight in ounces of water per day. Okay, so make sure you're hydrating. Make sure that you're not doing things that mess your skin up, like smoking. Everybody knows at this point, smoking's really damaging. It wrinkles up the skin, the perioral wrinkles, the lips. Smoking damages the skin. Alcohol, dehydration, can mess up the skin. You want to be eating a good, healthy antioxidant diet, right? Getting those good polyphenols in. And then for supplements, some of the supplements that I love that I'll highlight. Number one, astaxanthin.
Wait a second. Spell that for us. I've never heard of this one.
Oh my gosh, astaxanthin is so good. It's one of my favorite supplements. It's a derivative of vitamin A. It's like an inside sunscreen, and you can use it for people. So if somebody burns all the time, then they need more antioxidants in their diet, or they need more supplementation of those antioxidants. So astaxanthin would be a great choice. And usually it's dosed around 6 milligrams per day. It decreases fine lines and wrinkles. It helps the skin retain its moisture. It helps your skin barrier. It helps those cells stay healthy. It's wonderful.
Is this something that people would take in a powder form, or is it a capsule?
Generally a capsule.
Okay.
Yeah. The next one would be B vitamins are essential for the skin. Going back to that whole discoloration and the immunity, like why do people have discoloration? It's generally like acne, rosacea. The immune system of the skin isn't healthy and strong. The B vitamins help with all of that. Some people can get acne with the B complex. So you've got to test the waters and make sure you're not that one in a blue moon person that's going to have an issue with it. But predominantly, people get great skin with B vitamins, and especially B5 is the number one for acne, basically. The next supplement that I love is collagen. Collagen can be taken as a supplement. Amy Myers has a good one. There's so many good ones out there. It's hard to choose, but
So when you say collagen, is this type 1 and type 2 both? And is there, I've seen collagen powders and then collagen peptide.
right.
What is the difference between collagen powder and collagen peptides?
It's like coin a term because collagen, when somebody says peptide, it's a protein. Collagen is a protein. And the main distinction between collagen 1 and 2 is that collagen 1 is your skin. These are general. Collagen 1 is your skin, and collagen 2 is more like connective tissues like ligaments and tendons. In general, just taking it as a supplement. So like a powdered supplement generally, because you have to take a lot of it. Usually it's a scoop powder that people can add to a smoothie or their drinks in the morning. You can also get collagen from the food that you eat, right? So back in the day, our ancestors used to eat like the cartilage and everything of the animal. So nowadays, what people can do is like when they make, say, a chicken noodle soup, is make their soup with a whole chicken. Put the whole chicken in there. So all that connective tissue and the cartilage that's on the chicken is going to melt down into the soup. And if you've ever made a soup and then you put it, or if Brett ever made the soup,
Yes.
and put it in the fridge.
It's not me. It's not me making the soup.
And well, you put it in the fridge and then it has that gel layer.
Yeah.
That's that gelatin. That's the collagen. And consuming that is like when they're selling collagen powder, that's what they're selling. They just dehydrated it. It's desiccated. So making it at home, it doesn't have to be like a novel supplement. Like use the ingredients that you have at home. You can even buy gelatin, right? Like, remember Jell-O?
Oh, yes. You're saying that Jell-O is actually good for me? Or would I be better off doing bone broth?
Bone broth. Yeah, bone broth is going to be good for your collagen production.
Okay.
But yeah, making your own like homemade Jell-O so you can buy gelatin that doesn't have like additives and flavors and sugars and all that. You just buy like a natural gelatin, doesn't have anything in it. And you can mix like berries. You can mix stevia if you want it like sugar-free or like some natural sugar, make it yummy and make little chunks, cut it up and pour it into like an ice cube container and then have little pieces of it once a day. That's what we do at home. I feed it to my dogs. They love it.
These are the things that I think many of us who don't have the same access to we do have the access, but we're not looking at those studies. And you have this unique position where you're actually seeing women, you're making these recommendations to them. You're seeing them 6 months and a year later, and you're actually able to see the difference, not just in their appearance, but in their labs. And I think for so many of us women, we're like, God, everyone's telling us to take everything and to do everything. And it's so nice to hear the things that really matter the most. Like you said, these are the basics. And to know that collagen really does make a difference. Do you see when patients come back after applying some of these remedies, do you see a difference?
Yeah, definitely. And patients' reports too. So telltale signs beyond the skin is like your hair and your nails. And I've had patients that their hair's not growing, their nails not growing. And collagen's one of those kingpins. Once they start adding it in, they're like, my nails are so hard. My hair's growing like crazy. That's all part of that protein synthesis that we need. They're eating a nutrient-rich diet too, so, and most of the patients are on the B vitamins and the vitamin C.
Is vitamin C another one you would recommend for skin?
Yeah, definitely. Vitamin C helps your body make collagen. So it helps build up that collagen. And then what's more is that vitamin C is an antioxidant. So again, going back to what heals your skin from the oxidative damage, whether it's like the light causing oxidative damage or pollution, chlorine in the water, as we take our showers, is harsh on our skin. So vitamin C is helping our cells resolve that and heal from that.
When it comes to the appearance of skin, how detrimental is alcohol if we're just talking about like your skin's appearance?
Oh my gosh. Okay. So the thing is, alcohol is a poison. Need I say more? I mean, the things that hurt our body hurt our skin. Our skin is just the same cells, it's the cells of our body. I mean, particular to alcohol is it's going to impair your liver function. And your liver is the main organ that's detoxing your body. So if the liver's not clean and detoxing, then that all those products, that waste of detoxification's got to go somewhere. So oftentimes it does go to the surface of the skin and cause inflammation and puffiness, acne, things like rosacea, or just inflammatory redness, erythema of the skin, puffiness under the eyes, right? Alcohol is not a nutrient. It's not a nutrient. Like there's a saying, let food be your medicine, and alcohol is not a medicine.
So when someone comes to you and they have stopped drinking, what kind of changes do you see in the face?
Usually they lose a lot of water retention in their face and under their eyes. Their sleep improves always. Their mood improves. So your mood, when somebody has a great mood, they glow. They have that inner sunshine. And alcohol is a depressant. People get into cycles of self-medicating probably, where they have the blues and then they're drinking, or they have insomnia and then they're drinking and then their insomnia is not improving or their blues are not improving. When they pull back that obstacle, it's an obstacle to cure, like
What do you mean?
It's impeding the way their body can function. So when they remove that agent that's harming their body, preventing it from moving forward and healing, then they can get a good night's sleep. Everybody knows that when they get a good night's sleep, their skin is better,
When I was drinking, that was one of the things that's kind of changed for me is that, and I used to joke around with all my girlfriends about this. I'm like, God, the older I get, the more time I have to spend in the mirror putting on more and more makeup just to kind of look the same. And I don't feel like I have to do that anymore. Like when I would wake up the morning after having whatever champagne the night before, I just would be like, God, I have to work so hard to like bring my face back to life. And I thought it was age, and maybe some of it is, but it's just so completely changed, realizing it was sucking the moisture out of my skin and making me inflamed and making my eyes puffy and all of these things that it's saving me a lot of time in the morning getting ready. The person who listens to my show, they don't want to be average. They don't want to be in normal ranges. They want to be optimal. That's me. What are the optimal supplements that you're going to recommend to someone who wants to be their absolute best and to age powerfully with vitality? And, maybe I don't want to live to be 100, but however long I live, I want to be optimal.
Okay, so that's like what supplements are used for anti-aging, right? We got to talk about what is the aging process. What does it mean? What's aging, right? Now, currently, age isn't considered a pathology. And because of that, there's not a lot of funding to back figuring it out. But there's some research institutions that are working on it, and there's some gene mutations and disease processes that rapidly age that person. So those populations have been studied, and we do kind of have a roadmap of some of the mechanisms of aging. It's kind of nebulous. And that roadmap currently that's been mapped out it's basically the degradation of the cell. The cell's breaking down. The cell breaks down, the mitochondria break down, the DNA breaks down, the telomeres break down, and it can't repair itself through processes of reactive oxygen species. So that's called ROS. So that's like the sun hitting your skin is an oxidative damage to those cells. But it happens on the inside too. It happens on your inside cells, even when the cell makes energy. Just for making energy, ATP, it's going to make ROS, reactive oxygen species. So there's ROS, problem, oxidative, and then there's inflammation that's breaking down the cells. So that's like tumor necrosis factor, IL-6. These are bad, they're like problematic. And then you have in the center of it the cell can't replicate itself in a healthy way. That DNA can't turn over in a healthy way. And that's thought to be through a process of SIRT1 and cell senescence. So that's the proper turnover of cells, making good, healthy baby stem cells of the body. Okay, so we've got that kind of as a roadmap. And then we all know what happens as we increase in age. Dementia, the brain, the vision, our eyes, bones, osteoporosis, the heart disease. It occurs as we age. Cancer, right? And then fragility. Our bodies become feeble. You know, that's like our bones and our skeletal muscle mass. So when we look at it through that lens, we're talking about supplements that are used to augment. Okay. So I would highlight, first off, magnesium. In school, we always had this joke: if you don't know the answer to the question, choose magnesium.
Wow.
Because it has 300 functions of the body. Like, when in doubt, magnesium's going to do it. And our soil is deplete in the nutrients. So our soil just doesn't have those minerals that it used to. Even if somebody's eating a healthy diet, they're probably not getting enough magnesium. And soil is like its whole other topic, but it needs a lot of attention. So magnesium, it's essential. Most people are deficient. Magnesium's main thing is it's going to protect your brain. So it helps prevent dementia. It's going to help your bone density, and it's going to reduce risk of colon cancer. So we highlight that one. And magnesium is pretty safe. Like, the worst thing that can happen if somebody takes magnesium is diarrhea. Maybe lowers blood pressure. So, okay, be careful out there, people. If you're on antihypertensive medication, don't pile up on the magnesium or get a bunch of magnesium IVs or something. Be careful. But in general, it is safe. And usually it's dosed around 300 milligrams per day. The other highlight for magnesium, it helps you sleep, and it helps your skeletal. So it helps basically your skeletal muscle mass take in nutrients. Okay. Like, you know, people get leg cramps if they don't get enough magnesium, is a good example of that one. The other supplement would be vitamin D and K2. I would just combine those two because often they are, and they help each other. Vitamin K2 is so essential because it's going to help glue your calcium onto your bones. Okay, so we don't want calcium mobilized into the soft tissue of the body. Like, you don't want calcified heart tissue, right? Calcified plaques in the heart, calcifications on a mammogram. It's a red flag. We don't want that. We want the calcium on our bones. So K2 is the glue for that one. And vitamin D also helps our bones prevent and reduce osteoporosis. I see that all the time clinically. I have so many patients that have like osteopenia and they start a D with a K2, and then they'll repeat their DEXA scan and it's improved. The other thing about vitamin D, 90% of Americans are deficient. That's huge. And I'm really surprised with this one. I have patients predominantly that are very health conscious, and most of them are already taking a vitamin D. And I'm surprised how many people come in low. I was surprised in my own labs. And I was taking a vitamin D every day. I was still deficient.
Why?
Some people really need a high dose to flood their receptors for absorption. Some people don't absorb in the gut. Some people have to do injectable vitamin D to get those levels up. And then conversely, some people absorb really, really well. And like during COVID, I saw so many people that were taking like whopping doses of vitamin D and they were getting toxic. So vitamin D can be toxic. You have to be careful with it, and you got to run your labs to figure out, do you hyperabsorb it or do you need a high dose to get your levels up into the optimal range? But it's absolutely an essential. And studies associating vitamin D with dementia showed a 40% reduction in dementia and anti-cancer. You know, so vitamin D is a absolute essential. The next one I'd put on the list is creatine. Creatine, usually dosed around 5 grams a day. If somebody gets confused and they're like, is it milligram or gram?
Yeah.
Guess what? It's all grams out there, people. You're not going to find 5 milligrams of creatine in any product. It's usually a scoop, but creatine's main thing is skeletal muscle mass. So again, that's going back to the fragility of the body. They ran studies on creatine where they had patients that were exercising exercising with creatine,
Mhm.
just exercise alone.
Mhm.
And the patients that were on creatine with exercise had more skeletal muscle mass and then better exercise tolerance and endurance. Okay. Now, if you take creatine and you don't exercise, nothing. It doesn't do anything. There was no improvement in the skeletal muscle mass. So it's like it pumps up your activity. The next one I would choose, we got to highlight astaxanthin again.
Okay. I love that.
Astaxanthin is so good for your eyes. Your eyes. So as we age, we lose our close-up vision. We lose our night vision, macular degeneration, and astaxanthin helps augment that, helps stall it out. And I have really bad vision. I mean, I love astaxanthin. It's huge for me. But astaxanthin is also really good for the heart and really good for the brain. The next one would be turmeric. Turmeric is a good one. Turmeric helps reduce the risk of dementia, reduce risk of cancer by, again, protecting that brain, and it's anti-inflammatory. So when people age, they get so many aches and pains. They're prone to take a lot of Advil and that or aspirin. You know, the NSAIDs can be hard on the stomach, ulcers, kidney, heart. Like, we really shouldn't take too much of that stuff. And turmeric's kind of a workaround to help with the joint pains and help your body stay in action. But then an extra benefit protects your brain from dementia, like India that uses a lot of turmeric. And on autopsy, is this too gross? Sorry. People that live in India have a yellow hue to their brain because they consume so much turmeric in their cuisine, and they have reduced dementia compared to the United States. That one's excellent. And then the next one, you guys, is going to be CoQ10. The reason why I would put CoQ10 as an essential is because in reality, everybody's on a statin. I mean, everybody's on a statin for cholesterol. So that's the Lipitors, rosuvastatin, atorvastatin. Those medications block CoQ10 being used by the mitochondria. And it's likely that that's the mechanism of action why the statins can increase the risk of dementia. So that's a tough, that's tough. Like if somebody has super high cholesterol, they have to choose what between their brain and their heart. Anybody that's on a statin has got to be on a CoQ10, at least 200 milligrams. I mean, talk to your doctor about it. 200 to 600 milligrams per day is generally how much it's dosed. But CoQ10 protects your heart and your mitochondria. So going back to that map of like reactive oxygen species, the problem with the mitochondria, the cell degrading, it's going to protect your brain, prevent against cancers. It's a great, fabulous antioxidant. Another awesome antioxidant is alpha lipoic acid. So that's ALA. They use it to treat dementia, Parkinson's, Alzheimer's. I used it a lot during COVID when people lost their sense of scent. And that's like brain damage, right? Like the loss of scent is those spike proteins or inflammation attacking the olfactory bulb. And there were so many studies on ALA being neuroregenerative, so good for the brain. And I definitely saw clinically that patients that were taking it could get their sense of scent back. But ALA, predominantly good for the brain, improves IQ. That's always wonderful. Reduces risk of cancer, regenerates the kidneys. So that's another major organ that we want to protect. And then another one would be rapamycin. Let's talk about rapamycin.
Which I just started.
Yeah. So rapamycin, I mean, track the research on this one. It's novel. It's a medication, actually, but rapamycin basically inhibits mTOR. So that's a process that's messing with the DNA regeneration of the body. They found rapamycin way back when in the soil of Easter Island, brought it back to the United States, found that it had antifungal properties, and then used it for organ transplant patients. Okay, so it's been used in humans for a while. We know it's pretty much safe. As they've been doing their animal studies, so they have their mice, their lab animals on rapamycin and batch that's not on. They found that the mice that have been on rapamycin had extended health span. So it's not just that they lived longer, it's that they didn't have cancer, their mouse hair stayed black instead of going gray, their teeth weren't falling out, they were still making it through their maze, so they were still functional. And in the female animals, they extended their life 18% health span, and in the males, 10%. And then mostly doctors, have been so excited about this and swapping notes and curious about it. The thing is, since age is not a pathology, so there's never going to be a clinical trial where they launch for this. So currently, the trial is being run under periodontal disease. And that's a trial that's underway, and everybody's watching it to see how it pans out. And it would probably be moving into the functional world as an off-label usage for periodontal disease that occurs as everyone ages. Like our dentition is another thing that's so important to protect. So that one is a very exciting new med that's coming online.
Every single one of these are a supplement that you could get over the counter without a prescription, with the exception of rapamycin. Is that accurate? Is that true?
That's true.
Okay. So rapamycin is something you'd have to talk to your doctor about.
That's exactly right.
And I was surprised that when I filled my prescription, it's just 1 pill a week.
Uh-huh.
Yeah, very interesting.
Uh-huh.
Well, this has been fascinating. I know you're incredibly busy because I hear from people in my audience who live in California and they're like, I'm trying to get into Dr. Singler. But for anyone who's interested in working with Lee Regenerative at the clinic, how do you recommend people reach out to you?
Oh my gosh, I don't really have a big, we don't have a huge social media. We're very in real life. I'm not a social media person. They would call the office.
Okay.
I mean, I'm face to face with people of a clinician.
Right.
That's my main thing.
Thank you so much for sharing all of this with me. Part of me is excited because I'm like, yay, I am doing almost all of these things. But it is fascinating to hear from, because you're so honest about these things. Like here are the things that we've got good science on. Here are the things that I think make the biggest difference. And that's what we want. The person who's listening doesn't want to be average. They want to be optimal. So thank you for doing what you do and for sharing this information with us. I adore you.
Oh my
I talk
gosh.
about you all the time because you really have tremendously impacted my health. And I know I'm going to live with vitality because of the things that you're passionate about.
Oh my gosh. Yeah, Chalene. I mean, the credit is all yours. You're the one that's doing it. You're the one that's exercising and eating healthy and, staying on top of all the research. And I mean, it's just my privilege. It really is a privilege.